We're here with Kristine Erlandson at the 21st CROI in Boston, Massachusetts. And this is an opportunity to speak with someone who is doing work that is near and dear to my heart and our organization's focus, which is on overall health and getting there, getting to the research that's going to inform us as to what it is that we can learn about our bodies and how they're responding to the virus and to the drugs and to whatever we can do to make things better. So give us a background on you. I saw that you had 3 posters there that I noticed, and was that all you had?
I had one other poster, and then it was
so
on
I
an
missed
abstract,
that one,
but they were less, or one of them was less related. But
right, and maybe more complex and tedious, but some of them are pretty profound, and you learn some. One you didn't learn anything from, right, or much.
Right.
Right.
Yep.
But the other one you did. So let's talk about the good news first.
So I think you're probably referring to the quality of life one.
Yes,
Would that
exactly,
be? Okay.
Yeah.
So we have a fairly large, had a cohort at Colorado of about 360 people that completed a physical function assessment. We did some walking, and then just the ability to get up from a chair. So how strong are your legs? Do you have arthritis that's interfering with that? And then also looked at some HIV-related mortality by an index that's used a lot in the veteran population. And we looked at how that related as well with physical activity, how these impacted someone's quality of life. And I think what was interesting is we saw a really strong correlation between how someone felt both physically and mentally and how their physical function was. So you're able to walk about a quarter of a mile. The faster your walking speed, that your scores on your physical function and your mental health improved quite a bit. And then someone that tended to be more physically active had a much better score on their both mental and physical health.
Yeah.
So we just saw a real nice relationship between how someone's doing and how their quality of life is.
And we've seen there's been other studies that have focused on gait as it relates to mortality and so forth.
Gait is a very strong predictor of mortality in the elderly population. It's used quite a bit in geriatric populations. And the faster someone walks, the less likely they are, or the better mortality risk they have, so much less likely to die. As that gait slows down as people get older, then their mortality risk tends to increase.
Is this cause or effect? Can we say, okay, now that we know that, can we get you to walk faster? Can we get you to move more?
I think that's what needs to be done, is if we can increase someone's walking speed, do they then feel better? Or do they not walk quickly because they feel bad? And it's good. And I think that's the tricky part with, especially with our just data that's cross-sectional.
That'd be a great study to do.
Oh yeah, and there's actually kind of mixed data on if you exercise people, how well their quality of life improves. It kind of varies between studies.
Because some people just don't like to exercise.
And are they going to be more miserable if you
you're
try to make them exercise, or they have some sort of underlying problem that keeps them from exercising.
And many people have a leg problem, or they have like I have bursitis, I can't run anymore.
Right.
But doesn't mean I can't. I can hike. I can hike, 10 miles and 5,000 feet. But if I run across this room, I will have a problem. You're going to be hurting.
Yeah.
So those are things that you have to say, okay, there's my limitation.
And that was one thing we looked at with just the physical activity. The type of questionnaire we used for that assessed all sorts of physical activity. So it did not have to be running a marathon or working out 4 hours a day. It was any kind of physical activity. Included in that were things like gardening, construction work, going for a leisurely walk, things that were keeping people active but weren't necessarily going out and being, going to the gym, having an exercise routine. And we saw an improvement in the physical way that people felt and their mental health just by being more active. So I think that's important, like you said, is finding a physical activity that you like and you enjoy, and it's something you want to do.
Maybe somebody loves to swim. Maybe they love to just walk.
Yeah.
Or they like to bicycle. There's another perfect one.
Yep.
But the other thing I'm thinking is, I've seen people, and I want to say specifically, but there are people I know who have gone through a traumatic situation with a bad leg, and they're like elderly or older, and they now have this limp or something, and so they've been through rehab and physical therapy, and they got to the point where they're training them. They've said, okay, in the training it's lifting your leg, and and then it's kicking your leg,
and gradually getting that strength back.
But I've seen them that this was the exercise I did specifically for that leg, so they think this is really good to do ongoing, which it is. But they're limited by the fact that they can kick like a rocket.
Yeah.
But I gotta get out of this chair, you know, and I'm
Yeah.
thinking like,
Yeah.
what is going on there?
You build up one muscle without the other. Yeah.
I'm saying like, okay, this is telling me and informing me that this person has amazing capability.
Something's there. Yep. Mm-hmm.
But that if they were only doing everything else, so maybe the diversity of exercise, like swimming, which they say is really good, no low impact, whatever. Of course, you have the chlorine. But this is the thing. I think we maybe have to really think about how would we analyze and how would we, first of all, you want people to do things they're going to do.
Right.
Because there's no exercise that's good unless they're going to do it.
Right.
So how do we move into some research that's going to answer that question, that we'll end up with people who are going to understand this. Maybe we should just explain it to them and say, you know, you can probably do almost anything you want. You just have to do it often enough or regularly enough.
And that's what the physical health or physical activity guidelines that are put forth by the Centers of Disease Control recommend a certain number of minutes per week, and it can be spread out however a person wants, doing moderate physical activity. So it doesn't specify the number or the type of activity or how many minutes have to be spent on each day doing it. Just gives you an overall, this is how much we think that people should exercise in general, not even specific to HIV, in a week to have the cardiovascular, bone, muscle benefits from it. I think one question that's important to answer in HIV is that number the same? Do people with HIV need to exercise more? Would they have the same benefit by exercising less? Is there an exercise that might be more beneficial in the HIV population? Just knowing a little bit more about what exercise is good.
Maybe we do a general population study, and then we nest various disease states within it.
Yeah, and like for rheumatoid arthritis, there's certainly better exercises that are better for that patient population that's not putting the stress on their joints. Like swimming would be fantastic for people that have pulmonary disease, just because of that little bit more humid environment, kind of doesn't, the cold air isn't irritating their airways and stuff. So there's definitely exercises that are better for certain diseases, and I suspect the same might be true for HIV or all the diseases that go along with HIV. So,
that's exactly.
Which is when it gets tricky, because now you have an HIV patient with pulmonary disease and arthritis.
Almost nobody living with HIV is living with just HIV.
Exactly.
It's like cardiovascular, pulmonary, diabetes, bone disease. Yeah, it's ongoing. Or multiples,
right?
You know, so yeah, I think it's a very interesting subject. I think people can, you know, obviously keeping moving is good. No doctor's ever said don't move and eat really bad foods. Yeah. You know, like there's a no-brainer. But
it does help that the doctor actually reminds you to do it, because I think if your doctor's not necessarily questioning it, you tend to, you know, your doctor keeps pestering you every time you come in. You maybe start to think about it a little bit more.
What are you eating? How are you eating?
Yeah.
Dietitians, nutritionists, people that are going to be able to inform you. And maybe we do educational programs like this. I mean, watching this, the person might say,
maybe I should exercise. There are a lot
what
of
the heck?
benefits.
I might be able to do amazing things.
Yeah.
But when you talk about moderate, I now go the other way, because like I said, I do a lot of very, very long distance stuff some cases to exhaustion.
Yeah.
But I'm trained, I'm conditioned for that. So obviously somebody starting out is going to be probably, I can't do this. You know, they get 2 weeks in the New Year's resolution thing. But it would be possible for somebody to just break through that barrier and say, look, it really isn't pain that I'm feeling, it's just the fact that I've not done this for any number of years.
Oh, yeah.
And so we have to get through this startup phase.
And starting gradually. Because, I mean, if you go out and run 10 miles and you haven't run for a while, you could have a stress fracture.
Kids can do that.
Yep, building up to that.
But older people are going to have to work really slowly and eventually get through that and work hard to get through those barriers, those benchmarks.
But be comfortable. Don't push yourself to the extreme where you're having injuries because you're starting to exercise.
Exactly. Because, so I think that's why the CDC suggests the moderate rather than aggressive. And, you know, moderate's always good, at least at first. You know,
to get up there. And there is a separate recommendation if someone's more vigorous in terms of their activity that may have further benefits. But I think the key is any kind of activity increasing that activity is really important.
I want to stay in touch with you because I think that you can inform some of our programs that we're in. We have something called Health Challenge.
Yeah.
We're desperately trying to find as much information as we can about how to proceed in a very methodical and, as you say, a very, very appropriate way for the right people. And we'll get there. But your information, the work that you're doing is really helpful to answer kind of some of the duh questions, but also some of the more, complex questions that we need to answer first. Yeah. Thank you very much,
You're
Kristine.
welcome. Thank you for the
so much.
opportunity.
Yeah.